declines of all hormones with age. So at age 30, you start really declining in growth hormone at such a level that you don't have so much more left at age 80. There's really a drastic decline, especially of growth hormone, but also of IGF-1. And so this makes that there's growth hormone deficiency is quite frequent. As soon as you start aging, showing aging marks on your body, you are probably getting growth hormone deficient. So after age 30, gradually those growth hormone levels decline at a too low level. And maybe in some people are around age 25, 26. So I should have started my growth hormone treatment at age 31. Unfortunately, I only started at age 38. But anyway, it's never too late to recapture most of the good effects of growth hormone. So all adults above age 30, for example, start really aging. There's growth hormone sufficiency in youth, in most people, and then there is growth hormone deficiency in people getting older than age 30, and you see it on the face because this is really one of the most, if not the most important hormone to keep you young. So what does growth hormone do to adults? Well, basically, let's look at growth hormone deficiency, and you get then signs of aging. Eyebrow loss, for example, especially in the middle, is typical for growth hormone deficiency and reversible with growth hormone treatment. You get also those droopy eyelids that are also partially reversible, but to really reverse them when they are, you need to inject by mesotherapy locally the growth hormone. And also those sagging cheeks specifically, and those greater wrinkles that you get when people get growth hormone deficient, because growth hormone is really a hormone who gives elasticity to skin again. So sagging cheeks is actually the most visible sign, the most frequently, in a study I published a long time ago. And you see here that the pseudogynecomastia, fatty breast, and the fatty abdomen also are typical of growth hormone deficiency. This is fat-reducing hormone, so you don't have enough, you get more fat on those places. And specifically, a real sign is the muscle atrophy or hypertrophy that you get, soft palm, that you can check on yourself, and it's one of the major ways I check on physical examination if the person gets enough growth hormone or not. And then you have those longitudinal lines on the nails that are very typical, and they can disappear about a year or a year and a half of treatment. Usually 12 months is enough to get recover them. And then adults have also complaints, they suffer. And typically it's typical anxiety. When I stop my growth hormone treatment for about 2 days, I get anxious without a reason. I feel that there's more anxiety in the world, something like that. And it can even go into panic attacks in people. You have 4 times more panic attacks in growth hormone deficiency. Studies show that. And you have also, here's another study actually that I published here. And it's exhaustion is the most frequent sign actually you get with growth hormone deficiency. They're not only tired, they have extreme fatigue, exhaustion, and they feel also powerlessness. They don't have the energy to cope with life actually. So it's even a powerlessness that concerns life. They put life even into question. Is this really worth living this life? And it's usually due to growth hormone deficiency. So you have extreme feelings of uneasiness. This is the study I published actually in the anti-aging news journal of the A4M that gives good review of that. But it's already a long time ago. It's 1997, and everything there is still valid. So you get really, what about premature aging, and what about premature dying? Is there a relationship with growth hormone deficiency? Yes.